Okay, so welcome everyone. It is a pleasure to host all of you. So, good evening and a very warm welcome to all of you for joining us today. My name is Dr. Paridi, and I'm a part of the team at Echo India, where I've had the opportunity to work closely with QMed Knowledge Foundation in bringing this webinar to life. And it is a genuine pleasure to welcome all of you to the launch of today's webinar, Information to Evidence Foundations. Uh, Before we begin with the webinar and the other addresses, I would just like to take a moment to share why this webinar matters. We all work in healthcare, wherein almost all the fields require research, and we are surrounded by more information than ever before. The real challenge today isn't finding information, it's actually knowing how to turn that information into reliable, trustworthy evidence that we can actually act on. And that's exactly the gap where this webinar is designed to address. So over the next 90 minutes, you'll be hearing more about the organizations, about ECHO, about QMed, about the webinar itself. There'll be also be a few minutes to have a discussion round. So please keep your questions ready. I would encourage everyone to keep putting their questions in the chat box as well. With that, I would like to hand things over to Ms. Vasumathi, who's the founder for QMed Knowledge Foundation. Ma'am, if you can please address the gathering.
Sure. Thank you so much. I'll just share screen. Yeah. A quick overview about QMed Knowledge Foundation. We were founded in December 2008. And why? Because literature searching, that is correct searching, is a crucial professional skill, not just a task to get some references. And unfortunately, very often that's how it is executed. And you might say everyone knows how to Google. Exactly, they do. But correct searching is about a step-by-step structured method. And most importantly, it has to be reproducible. That is, if any one of you in the audience and I use exactly the same characters that we feed into PubMed, both of us will get exactly the same results. But if we Google or use Google Scholar, we need not get the same results. It's based on our browsing history. Going forward, that will be the same with AI. And that's why the structured searching is very much essential. And what we learn here will also make a difference in AI, Google Scholar, etc. QMed at that time still has the expertise to teach this correct step-by-step searching. So how do we say that? I am the founder. I was a medical librarian at Hinduja Hospital and Health. And now the last nearly 19 years, Foundation, QMed Knowledge Foundation, I'm the founder. I've done a lot of lectures and workshops. With my team, I've created the e-learning courses on PubMed, reference management, etc. I have expertise in doing systematic review searching, etc. I've even conducted a workshop for ICMR Delhi and another ICMR supported workshop. I'm recognized as a speaker by the MUHS, MMC, and as a member of the AHPE. Had an international award, an education grant for QMed by Pfizer, and a Lifetime Achievement Award. So all this has been a good way to show that we are credible in what we do. Along with me, my team, Fatima is a head of technology at QMed. Interestingly, she is a librarian like me, but has become an absolute expert in technology, handles our websites independently. Dipti, you can see, is a BSc. She joined in as a content coordinator, doing a whole lot of things. Today, she can do as good searches as I do. I almost make her do all the systematic review searches. I just do an overview. Accounts and administration, they are ably assisted by our colleague Jayanti, and an office assistant, Rajendra Nahak. That is our small team with a very big goal of reaching our teaching, sharing it all across the country. These are our e-learning courses. I'll talk more about them at the end. Here it gets a more easy to look at you what kind of courses we have. The first two are free and the others are available at a very reasonable cost. But I'll talk more about our plans to share all this with you through the Echo platform in a much better way at the end. So yeah, that's about us. This year we were recognized by the Maharashtra Medical Council for webinars, and very, very importantly, very proudly, we got onboarded onto the Echo platform. That's something which we consider ourselves very lucky to be, because we know that Echo does great work. We can learn a lot from their model, and we are hoping to learn a lot and give you all a lot with the shared learning. Yeah, that's right. So we want to do a blended learning approach and hope to do great work. So that's it from me, and hand over back to Dr. Paridi. My colleagues, you can see on the screen, they're there, Deepthi and Fatih.
Thank you so much, ma'am, for just giving a brief overview about your organization. With that, I would like to invite Ms. Deepa Jha to give an overview about the about ECHO. Ma'am, if you can.
Thank you, Paridi. And good afternoon, everyone. I would start by thanking QMed Knowledge Foundation and Ms. Vasumathi for uh, coming on partnership with Echo India and starting with a very interesting program. And I would like to welcome all the participants on today's session. My name is Deepa Jha. I work as General Manager at Echo India, and I have been given a task to talk about Echo. So I'll not take much of your time. When we talk about Echo, Echo is a tele-mentoring platform. So people get confused. It's not a telemedicine. There's no telemedicine doctor patient treatment happening, but it's a learning platform. It's a mentoring platform, like I said, and it's a knowledge sharing platform and building capacity with the learners group, where we connect the experts from anywhere in the world to the learners group without moving this. So the core idea is moving knowledge, not the people. And ECHO's expansion is extension for community healthcare outcomes. We are registered as a non-profit trust and based out of Delhi. So it's a guided lifelong learning model that is adopted, and it basically connects the experts and the learners, and it's not a one-way learning. It happens multi-way. So when we talk, like, experts will be guiding the learners will bring in the cases and discussions, so that all of them come together in a close knit, and there's a community of practice that comes up. So Echo, like I said, the learners and the experts are there, so we call it a hub and spoke model. And the gist is lies in the case-based discussion. When I say case-based, it can be your queries, questions, case studies by the participants. So there's a lot of engagement. We have the ICO platform to support the model, but the core lies in a lot of engagement with among the learners, and getting their queries and questions solved by the experts using technology. So coming to back to Echo, we work on partnership basis. It's a non-financial model that we follow, and so the participants and experts, they come together, and we believe in building the capacity. So we are founded. Project Echo came up in 2003 in Albuquerque, New Mexico, and in India it got registered as a non-profit trust in 2008, and primarily working in healthcare, but we have expanded to education, agriculture, climate, and other allied SDGs. So the ECHO works, like I said, in partnership. We have an agreement signed with Ministry of Health and Family Welfare, and recently with the Ministry of Agriculture and Jal Jeevan Mission. So education, livelihood, other areas are expanded. It's a disease agnostic area. So the core can fix into the model flexibly, and then the learning happens. Today's program is also fits in very deeply into what ECHO believes in, and we have lots of networks, and there are many hubs, 100 over 530 hubs who are using this platform to disseminate knowledge to the learners. Um, like we are majorly working on healthcare, and we have connected the frontline workers and the last mile and remote areas to the experts sitting at the national level, at the global level. So that fits in very well. And today's program is also fitting into the eco model so well, like turning the raw information into usable evidence that requires the same vision that eco is built on: structured knowledge, applied learning, and I would again say thank you, QMed, for giving us this opportunity to start the program with you. And Vasumati ma'am, thank you so much for your guidance, and Deepthi and Fatima, thank you for your support, and to my colleague Dr. Paridi, who has been leading this from the front on behalf of Eco India. So with that, I welcome you all for today's program. Looking forward to the great learning journey with all of you. Thank you. Over to you, Paridi.
Thank you so much, ma'am, for giving a brief overview about ECHO and ECHO India. With that, I would like to invite the QMed team if they can just give an overview of the webinar and then start off with the webinar as well.
Yeah, I'll take over.
So, Vasumati ma'am, I think I lost you in the middle.
Can you hear me now?
Yeah, yes.
Yeah, right. So thank you very much. Thank you, Deepa ma'am, for your nice description of the ECHO model. And I'd just like to tell the other participants and simplify that a little for you. If you came for this event for a live lecture, you'd always find it the best, because you can see me directly, I can see you directly, I can see blank looks, ask you what's the problem, and so much more. Webinars are second best. You get to hear the person live, you can ask questions, etc. But the ECHO model is such that any such learning is taken into more detail, and we'll have small groups, we'll have short sessions, teach something in detail, and keep engaging with you, because you can, in a smaller group, you can ask questions and get answers. You can later do it through other means and so on. So it's a great add-on to anything which can be something between direct and only a webinar. So that's the whole idea, and we are hoping we can do a lot of great blended approach as we go ahead. This is our inaugural webinar. So to all participants, once again, a very big welcome. With that, I'll start my slides and get started. So this program is called Information to Evidence, the Foundations. Now, as Dr. Paridhi said earlier, finding the right literature is really something very important. I also said the same thing, because today we have a huge flood and there's no end to what all we can find. There's too much of it. The general tendency is to go through 2-3 pages, make do with what there is. But that may not be the best of literature. Once you find the best, then you go on to appraising it, choosing what, maybe treating your patient, maybe doing research, but maybe actually working towards creating evidence. So it's information to evidence. the foundations are all about literature searching, just the basics of literature searching, but highly structured basics and some important must knows. So that's what we are going to talk about and get you onto. Now, for searching, we need to know what we call the anatomy. Everybody is in healthcare. Everyone knows that whatever course you're doing in healthcare, you will do anatomy first. Without that, you can't do any course that you're doing in healthcare. Later, there is more anatomy to learn, deeper anatomy, like in medicine, those who go into specializations do cardiac anatomy, neuroanatomy, and so on. So that's in depth. And techniques on how to do certain things. In this lecture, we're just going to do the fundamental anatomy, the equivalent of first MBBS or first BBS, whatever. More anatomy will be through our e-learning courses and the echo blended learning, which we'll talk about later. Right. So anatomy of searching. You need to know about various information resources, how to map them to your information needs, and any information resource, you need to know that resource. To give a very crazy and simple example, if you want the phone number of somebody in the city of Mumbai, that's where I live, I'm not going to look at a Delhi phone book or equivalent source. So you know what a source covers, what it doesn't cover, maybe what are its special features and more. Then for the actual searching, I'm going to put across 2 fundamentals and 4 must-knows of searching. I'm going to use PubMed as the platform to show you these things because I've got to take any one and that's free for anyone to use. Let's go ahead. So first, a little bit about information resources, how to map them to our needs, for which we need to define our needs. And needs, if I put them broadly at 3 levels, general to specific, I've put 3 questions here. You can see the first is very broad, very general. The second is a little more specific. The third is very, very specific. And broadly putting it, I can say that this is something which maybe undergrad students would want to know. This is something which a qualified MBBS, BDS, etc., who's become a doctor but maybe is still doing residency, etc., post-graduation, they might need to know. This is something which a practitioner or somebody higher up who's helping in formulating the country's guidelines, etc., they would want to know. They would want to know what is the exact truth here. So again, there's no hard and fast thing, but I've just given you a broad example. So there are these different levels or depth of levels at which one needs information. Now, what are the resources available? For the first kind, one needs to refer to basic or background factual information resources like all these. Now, all these we've studied right from school days, except that when we come into healthcare field, they are more specific. And all these are available in print as well as electronic. So we are not talking about print electronic here. It is the resource. And these are sources that satisfy a very basic need. In this webinar, we are not going to talk any more about these resources because these are things we are all familiar with. Let's go to the next level where we wanted adverse effects of antimalarials. For this kind of query, the most common source to refer is journals because journals are updated regularly. First thing, they are brought out at regular frequencies like weekly, monthly, quarterly, etc. And newer research keeps getting published in them. Journals are published sources. All these are called gray literature or unpublished. When we say unpublished, what we mean is it's not through a formal publisher. Thesis, for example, is through the university, and there's one copy with you, one copy with the university. So it's not publicly available. These days, they are put up on websites, but it's not really commercially available for sale. So all these are called unpublished or gray literature. One could search all these depending on the depth of information you're looking for. But highest level, we wanted to know which of the two drugs, artesunate or quinine, was more effective for severe malaria. For this, the kind of information you need comes from analysis and synthesis of these kind of research-based resources. And what kind of publications are these? There are publications called systematic reviews, which may be published in journals, may be published in independent websites. Systematic reviews give you evidence. Today, has all the research from all these kinds of publication shown that artesunate is better, or quinine is better, or both are equally effective, or there's no clear answer yet? This comes from pooling the results of several studies, several large studies. From systematic reviews, you get publications which are useful for practitioners, clinicians. So you have guidelines which are brought out usually by the country's head research resources like ICMR, or by professional bodies like the different medical, dental, other associations. And then you have summaries. These are products brought out by commercial publishers, like there's an UpToDate, there's a Dynamed, Clinical Key. They bring out summaries about diseases, about drugs, and they keep updating it every quarter at least from the evidence from systematic reviews. So these are all the reading that somebody needs to know at a highest level, taking it for granted that it has summarized all this stuff, but done properly. So if you see research papers alone, now journals have both kinds, research, non-research papers. If you take only the research papers, they are put in something called an evidence pyramid. And if we divide this pyramid into three, the basic articles actually kindle ideas about research. Primary research is all kinds of research done on patients. So these are smaller, these are very large. Large groups, like 2 groups of 100, they are studied and compared and so on. Cohort is also large. These are all smaller groups. But right at the top, systematic reviews, meta-analysis, they come under secondary research because it's research done on research papers, not on patients. So this is a summary of all kinds of information resources. And the more we learn about this, when we do searching, if we want only systematic reviews or we want only these kinds of studies, databases like PubMed allow you to refine your search like that. And again, for very precise, you could use what are called filters. But if you don't want to miss any, then there's a structured method of putting all kinds of keywords to make sure you don't miss anything. So in the anatomy of searching, we finished that first bit. Let's go on to the second thing, which is know your resource. You have to know your resource first. What exactly is PubMed? I told you I'll use PubMed as the platform to show how you do structured literature searching. Most people on this group here in the audience must have used PubMed sometime or at least seen it. So I've put 6 options, and I usually in a live workshop, I ask, which one do you think fits in best? So here I'm not going to, because later I'll engage you in some questions. I'll give you this answer. PubMed, exactly if you want to know, is an index. It's not a search engine, because a search engine is Google or Google Scholar. Google Scholar is special search engine. Google is generic. PubMed is first a database of articles, and it has a search engine to search that. And it's not the rest either, because there's no full article inside PubMed. Even if you find free article, you're led to the journal article or to PubMed Central for the full text. It's not inside PubMed. Now, PubMed is an index. What do I mean by index? It's an index to articles from over 5,000 journals. Let's understand a little better. What is an index? When you search for a word or phrase, an index tells you your search term is available here. What do I mean by here? Let's say a book index. A book index is right at the end. In the beginning, you have table of contents saying chapter 1 is this, chapter 2 is this. Index comes right at the end, where if you search the word stroke, it tells you the word stroke appears on page 434 and 435. Then you go there and see what is available about stroke. Now, for PubMed, because it's an index to articles published in over 5,000 journals, going back to 1700s and updated every day now, the search term page number alone is not enough. The index will give you what are called bibliographic details like this. I search stroke, I'll get all this telling me that the word stroke is in this journal. This is the title, these are the authors. This journal, 2026, Jan, etc., etc. Now, what are the different details here? Article title, authors, the journal details, PMID, it's a unique ID in PubMed. All these things are searchable. That's why I'm pointing out on this. And each is a unique area of a PubMed result item. When you see results, all of them will look very similar. In this case, there's no abstract. But if there were an abstract, you would click the title to read it. I think most people will be familiar with this. But it's important to know that there are so many areas of fields, and we'll explain why. So summarizing, I've already said this. When we search, we get only bibliographic details, no full text. Full text is only as a link. So this is how much one needs to know about PubMed. And if you're teaching it to a student or a junior, please teach it this way and don't tell them it's just a medical search engine. It's much beyond that. That's important. So we finished the first two and we go on to searching. The two fundamentals will be very quick. The main part of today's talk is all these, where I will also be involving you. So the two fundamentals first. The first fundamental is anytime you put in something to search, the results contain our search terms, but may or may not be about it. Again, it's something everybody's familiar with, but doesn't know what to do with it and why it happens. Let's take a look. In PubMed, if I search asthma and COPD patients, then I'm just showing two sample results. The first one is something about asthma and COPD. The second one has the words, but actually says excluding asthma and COPD. So the results contain the terms, may be about, may not be about. And we have no clue if we get 100 results, what is the percentage which will be about, what is the percentage which will not be about, and this percentage can keep changing with time. The second fundamental is results contain our search terms in specific areas like this. So here, in this case, asthma COPD came in the title. Sometimes it could come, any of these words could come in the author area, in the journal name, etc., in the abstract as well. And we'll find its relevance soon. So those were the two fundamentals, and we go on to the must-knows of searching. Tags, truncation and spelling variations. How do we combine search terms? How do we use mesh for searching? If anybody feels, I know most of this, I would say, hang on, you'll learn it differently. So first we take tags. We use tags to find our search terms in specific areas. We just learned all the areas. So we can use tags to say, I want the word white in the author area. That means one of the authors in my search should be with the name white. I want asthma to appear in the title because At least majority of the articles will be about asthma. Very few should say excluding asthma kind of thing. I want the number 107 in the page number area. It's not about number of patients, this kind of thing. So let's learn how to add tags. I've taken one word spine. I've tagged it with TI, which is short form for title. I want the word spine to come in the title. TIAB means either in the title or in the abstract or both together. So if I got only 25 with this, here I might get 7,500 anything, because all those title ones will come, but also those where it is in the abstract. JOUR, the name of the journal from which I get my results will be Spine. AU, author's Spine. Yes, there are some authors who have the surname Spine. AD is the author's address, that is Institute of Spine and Nervous Diseases or whatever, something like that, or Department of Spine Surgery, anything like that. And if we don't tag the word spine, it is searching all these areas, but do remember it does not go out of PubMed to search the full text. Full text is in the journal website or PubMed Central. So it's only searching all areas up to abstract. I put the number 143 and said page. So I want articles coming on page 143. DP is date of publication, which is the year. PL is country of publication. PL is place, that is country of publication. PT is clinical trial. The PT means I want the publication types that I get to be clinical trials. We'll learn a little more as we go. But here, this slide is to understand that if we do any tag, that's the area where we want our search term or keyword to be. And we'll learn something more special in a minute. There's one important area which we don't see normally, which is the subject or descriptor area, which means what the article is about. So if I see this one, then this is a title, but I'll just show you the slide itself here. If I click that, I will be seeing it like this. Now it says no abstract. This is here. But if I scroll further down, I will be seeing something like this. I've brought this up here in the slide, but actually I need to scroll further down. Then I see something called mesh terms. All these here. Mesh is the description area. So after you click to see the abstract, if you scroll down, there is an area called mesh terms. Mesh is the description area where all these words are what the full article is about. So in short, remember, mesh means about. And in this case, this article is also about spine, abnormalities of the spine, diagnostic imaging of the spine. Whereas the word spine was not in the title and there was no abstract. So we wouldn't know necessarily. Of course, reading it, those who would figure out could, but otherwise, it's when we see this, we know that it is about spine in addition to other things. How do we search this area? Like we searched other areas with tags, you just use your keyword and the name of the area is mesh. As simple as that. Then all your results will have the word spine in the list of mesh terms, even if it's not in the title or abstract. So now this is the real list of tags, where whatever I taught you earlier was there, but the most important is this, because only this gives you a guarantee that all your results will be about spine. If you see the rest, title, it could be excluding spine, same with title abstract. Journal title, a journal spine may have an article on movie review on Munna Bhai MBBS or communication skills for neurologists or something like that. That's in the journal spine, but nothing to do with spine. Author spine doesn't have to write only about spine. Author's address, same logic as journal. And all areas means any of these. But this is the one, all results are about spine. As I said earlier, even if the word spine is not in the title abstract. So this slide is very, very important. So let's do some practice exercises to understand this. I'd like you all to type your answers in the chat box, just so that you're participating. So I got this result. What tag did I use for the word drugs? Just let me know if answers are coming. Oh, sorry. Anyone's answering? Because I'm not seeing the...
Put the
Yeah.
answer in the chat box. So somebody has answered TI, drugs, bracket TI.
Yes, that's right. So it should be drugs, bracket TI. Then we've got it in the title. This one. Which are the areas it's there? It's there in the title as well as in the abstract. So
Drugs.
TIAB.
Yes. Drugs, TIAB in brackets.
That's right. Exactly. Drugs, TIAB. It's there in the title, also in the abstract. Of course, we'll also get results where it's only in the title or only in the abstract. But in this case, it is there in both. This one. Which area is this? This is the name of the journal. So what would be the tag for this?
Somebody has answered PL.
No, that's place of publication, country of publication, that is. You have the title, author, name of the journal, and year, volume, etc. So what's the tag for name of the journal? I'll give the answer. It's JOUR.
Yes, ma'am, actually. Gurudat and RK both mentioned journal and JOUR.
Perfect, perfect. That's right. Yeah. Right. This one. So if you see, this is the author's address. You remember the tag? AD short form for address. In this case, the first author is from Department of Synthesis and Technology of Drugs. So this way, when you're tagging, you know where it will come. And if you know you want it in this particular area, you use that tag. So this is one way of narrowing down your searches instead of just putting in words. So we've done the tags. I'm going to be giving you by tomorrow the most important slides, like that list of tags, what each one is. Let's go to truncation and spelling variations. We use truncation to tell the search engine in PubMed that we want to search for a word containing variations of letters or characters, like I have vaccine, vaccination. Can you see after VACCIN, here there's an E, here there are other characters. So when I want to search, I don't want to type in both words. How can I do this? We'll see. So in this case, it's coming before here, after this, any character. Here it's in the middle of a word, somewhere in the middle of the word. And here you have different phrases like this. All these can be searched. I'll just show you this. We use the symbol star in PubMed. Some databases have different symbols. In PubMed, it is star. So you can use it at the end of a single word, middle of a word, and in phrases. Let's see each of these. Thing is, for putting the star, you need a minimum of 4 letters. I can't put CAT star. So let's see what it works like. As I said earlier, vaccine star will get me all these variations: vaccine, vaccines, vaccination, vaccinated, vaccinations, etc. Here, I put a star just before the end. So it retrieves paralyzed with Z or S. Phrases, I put colo cancer with star at the end in each case. But because it's a phrase, 2 words, I also need to put the quotes. Once I do that, it retrieves all these options: colon cancer, colonic cancer, colorectal cancer, all the plural forms, and also something like colonic cancerous tissues, that kind of thing. So all these variations it will find. So as I said, one is you need a minimum of 3 characters. The other point, a common mistake that people make, is you need to remember it only gets more characters, that is letters or numbers or anything like that. But it's not required for varied phrases. Like, you don't need vaccination star if you want vaccination schedules, vaccination ethics, vaccination hesitancy. Vaccination star is for getting vaccination and the plural form. Once you type this, words that follow the word vaccination will anyway be there. You don't need a star for that. Only if you want to get the plural form, you need to put the star. So this is something people need to remember. Otherwise, it's unnecessary searching with this. Right. So we finished the first 2. We go on to combining search terms because we are not always searching one single word. So suppose I type in PubMed like this. First thing, I've not used tags at all. And I've combined this with normal English words, prepositions, conjunctions. But this will not work. The correct way is to combine terms with and, or, not, all in capitals. And interestingly, a lot of mistakes happen here. So I'm going to take 2 words, asthma, bronchitis, to show how combinations correctly work. These 3 words are called Boolean operators. Let's take just these 2 words to understand how Boolean operators work. Suppose I typed only the word asthma, and for the purpose of this exercise, we take it as I got 100 results. Separately, I typed bronchitis. Let's take it, I got 70 results. I put these 2 words here. Now, if I type asthma and bronchitis, how many results should I get? You can tell me less than, more than, or equal to something, whatever. What do you think I should get? Any answers coming?
Less than 70, less.
Less than 70, that's a good one. Because the question, when we say asthma and bronchitis, what we are asking the search engine is how many contain. See, contain is the first one fundamentally. Results contain our search term. So contain asthma and bronchitis together. That's our question to the search engine. And so it will be less than 45. Theoretically, we could get 70 if every author who wrote the word bronchitis also wrote the word asthma. In practice, that's not very likely. So I've just taken a number 45 as an assumption. There are 100 papers with the word asthma. 45 of them contain bronchitis. These 70, 45 contain the word asthma. Asthma or bronchitis, how many contain at least one term, either asthma alone or bronchitis or both? What would be the answer in this case? Here, there's no less than, more than. Have to give me a formula or the number.
So Becha Mohamda gave 170.
170. Okay. Anybody else?
More than 240. Pika Naredi.
There's no more than. You can
20
either give me
to
the
30.
formula.
Someone 20 to 30. Dr. Priyanka.
Okay. There's a formula you can give me, or actually do the calculation and give me. 100 contain asthma, 70 contain bronchitis. So saying 170 is not wrong, but it'll do something more. Maybe I'll explain that. So 100 plus 70, somebody guessed. There's a minus 45. Why the minus 45? You can unmute and speak if you can guess it. Even when I explain
Because
this,
it's combined asthma and bronchitis both together. So either we want asthma or bronchitis
or both together.
or both.
We want asthma or bronchitis or both coming together. So that way 170 solves it. But why does it do a minus 45? The same 45 is available here. The same 45 is available here. We don't want duplicate articles, right? Bad enough to have to read 125. It's a big number. So it'll remove one set of the 45. From both these, one set of 45 is removed and you get 125. Is that clear to everyone? Right? So both these are put together, but because 45 are same in both sets, one set of 45 is removed, the other is retained. Right. Asthma, not bronchitis, that would be 100 minus, because it is how many contain asthma, but not bronchitis. 100 contain asthma. How many contain bronchitis inside this?
RK gave 55.
That's right. That's the answer. So 100 minus 45, that's 55. Okay. So again, this is a very important slide. We'll be giving you these most important slides so that you can easily learn them up afterwards. Right. Order of typing the terms. Asthma and bronchitis, or if you type bronchitis and asthma, will we get the same results? We have got 45 with asthma and bronchitis. Yes, no?
BN said
The
no.
answer,
Yes, same
the
result.
answer is yes.
Yes, same.
Because the question is how many contain both together. The order of typing doesn't matter. These two words should come together in articles. 45 articles have both together. Asthma or bronchitis, bronchitis or asthma, either way you type, you'll get the same 125, because we are asking how many contain asthma alone or bronchitis alone or both together. But asthma, not bronchitis, is not equal to bronchitis, not asthma, because here it is 100 minus 45, here it is 70 minus 45. So the results will be different. So and either order you type, doesn't matter. Not, it matters. Right. Let's do some practice exercises. I want to learn all about peptic ulcer. I also want to learn all about duodenal ulcer. That is, I want to find articles where peptic ulcer is mentioned, duodenal ulcer is mentioned, maybe both are mentioned. So what operator will I put here?
And
Once again,
So one of the option and there's one more option given by RK, which is or. Subecha also is saying or.
So the correct answer is or, because and means only the articles where both are together. But I want to learn everything about it because each article may write different things about it. So some articles will have this alone, some will have this alone, some will have both together. That is why or. I want to find items in PubMed that discuss both ulcers together. This time it will be
and
yes, this time it will be and. So
and
papers where both terms are mentioned together. That's what I want because I may be looking for comparisons or anything about it. Okay. I want to find results that compare painkillers and sedatives.
Guru that said or and
It has to be and because I want papers where both are mentioned and both are being compared. So only if both are mentioned with and, then it will be comparing both. Of course, by saying painkillers and sedatives, not every article may be comparing both, but our chances of finding articles like that are higher with using and. I want to read about various painkillers and also about different sedatives. Here it will be or, because either this or that. Right. So in summary, it comes like this. If you want your search terms together, use and. If you want everything about your search terms, use or. So again, this slide will be given to you in the set of most important slides. Remember this, keep on revising this so that you don't make mistakes with Boolean operators. It's one of the most common errors simply because we are programmed that way. We think a cupboard full of peptic ulcer books, cupboard full of duodenal ulcer books. So we say and for both. We want everything about both, we say and. But here it is opposite because it's the words that are contained in the articles, not about it. So we've done these three and we go to the most important thing, mesh. PubMed has mesh. Some other databases have mesh. Some databases have something similar to mesh with a different technical word. So here we are trying to tell you the principle of something like mesh. We'll explain it now. So if you remember, we saw this slide on this title and we saw all these terms. We learned that mesh is the description area. It is what this article is about, all these things. Mesh means about. So this article is about multiple abnormalities and their diagnosis. It's about the female population, humans, diagnosis of lung diseases, abnormalities of the lung, and so on, spine also. So in a gist, you get to know this article covers all these things. And how do we? Yes, most importantly, all these terms are standardized, and I'll be explaining what I mean by standardized in a minute. How did we search? If I type spine mesh, I'll get this. If I type abnormalities multiple mesh, I would get this article, and so on. Where do you find standardized terms to search and add the mesh tag? In PubMed, if you look here, bottom right, there's a mesh database. If you use it on your phone, after this area, you'll find this. Below that, you'll find this. Below this, and finally this. So you have to scroll a good bit down. You click the mesh database, you leave PubMed, and you've come into the mesh database. You're searching the mesh database. Here, before we actually search, let's understand what is mesh. The full form is medical subject headings. They are standard terms in a thesaurus. You know what a dictionary is? Thesaurus is something which explains the context in which these terms are used. So there's a big thesaurus with lots and lots of mesh terms. Trained indexers, human beings, choose the best terms from this thesaurus and then they add them to the mesh area. So these indexers are employed by the National Library of Medicine where PubMed is compiled. They are given articles as they come into PubMed from, say, BMJ, NEJM, various journals. They are given according to their specialty, neurology, medicine, pediatrics, etc. They read those articles and from the mesh database, choose the best terms and add them to that mesh area. Now, of course, AI is also being employed, but they are doing a parallel processing. We don't know in what directions this will go in. But overall, that mesh thesaurus is used to add into this. So how do we find a search term in the mesh database? This is where we click that mesh database came here. And I want to find articles about stomach ulcer. So when I see titles and all that, I click, I go down in that mesh area. I must see the word stomach ulcer. But first I'm checking, is it a proper mesh term? I click search and I get an answer. Stomach ulcer comes here. It is a mesh term and it says ulceration of the gastric mucosa, etc., etc. Right. So in PubMed, now when you find it, it means that in PubMed, you can type stomach ulcer, tag it with mesh and get, so like this, and you get all relevant results. In all your results, the word stomach ulcer may be in the title, maybe in the abstract, may not be in either, but it will be in the mesh terms. Guaranteed, every result you get is about stomach ulcer. Some terms are not mesh terms. For example, I'm typing brain infections. It says no items found. There's no standard mesh terms like brain infections. If you get this kind of scenario, for now, just what you'll have to do is to search as TIAB, title abstract, because you know very well some will not be relevant, but that's the best way in the absence of learning how to find the best mesh terms for brain infections. That's a slightly more detailed lesson and we'll take it in the PubMed course when we offer it. So just now it would be brain infections, TIAB, that you search. Now some terms are different. When we type stomach ulcer, we got stomach ulcer. Some cases, let's say I'm typing pregnancy-induced diabetes. I click search. The standard term is diabetes gestational or gestational diabetes. Okay. This is the standard term for pregnancy-induced diabetes. And they also explain this is diabetes induced by pregnancy, resolved at the end. It does not include previously diagnosed women who are already diabetic, later become pregnant. For such a population, the indexer will tag it with this mesh term, pregnancy in diabetics. So mesh terms can be so specific as well. And that's why it's important to choose the best one. Another such example, spectacles. The standard term is eyeglasses and it says pair of ophthalmic lenses, etc. to aid or improve vision. It does not include goggles or non-prescription sunglasses, for which the mesh term is eye protective devices. So again, as I said, some mesh terms are very specific. It's important to find the best one. Right. So a quick tip for this, when you search your keyword in the mesh database, whatever you're typing, if you got a result, use whatever you find in the result. That will be the standard term. Like stomach ulcer, it was the same. Spectacles, the standard term was eyeglasses. Take that, tag it with mesh and search. So stomach ulcer was mesh. If it is different, then you're going to take that term and use it with mesh. No items like brain infections, whatever you typed, type it with TIA. Again, this is the slide we'll give you so that you remember how to use the mesh terms correctly for searching. Let's do some practice exercises. See the slide. I'll show pictures and you answer which term to search, which tag to use, whether it's going to be mesh or TIA. So in this case, I'll answer it. The rest will do it. I searched community-acquired pneumonia. I got community-acquired pneumonia. So this is the standard term. So the term to search will be the same. Tag to use will be mesh. I will type in PubMed community-acquired pneumonia mesh. Like this, let's do a couple more exercises. In this case, what would I do? You can unmute and speak if you like. Very good, very good. So no results. It's not a standard term. So you will type kapha TIA here.
Mesh hypotension.
Hypotension mesh. The tag will come after your search term. So standard term different. What you'll type is first always your search term followed by the tag. Okay, that's important. Everything matters like that. So if you see here, kapha, no items. Then if it's no items, whatever your search term is, which was kapha, you'll type with TIB. If cases like this, then you found a mesh term, search PubMed with the standard term. Whatever you find here, mesh. Not your search term. You're not going to do, because sometimes when I give this as quizzes, people still type low blood pressure TIB. No, you're going to search you got an answer. That is what you must take and search it with mesh. Then your relevant results will be very, very high and you're saving huge amounts of time. So we've covered all the 4 must-knows and we covered in the beginning information resources, 2 fundamentals, all this. We'll see how to apply what we've learned in the next few minutes. That's it, right? So when we do searches, every search has a purpose. We may need very specific articles, a few articles to read, a good number of relevant articles, or every available article, not miss any item. Most of the time we manage with either this or this, but there are times when you need this. I would suggest just take a screenshot of this because I'll be giving some exercises. I want you to say which of these. You can just tell me 1, 2, 3, 4 also. Just take a screenshot of this. Okay. So first exercise, I need articles about peptic ulcer published in 2022. Which kind of need was this? One, two, three, four. Which kind?
1.
Yeah, it is 1, which is very specific. The topic I'm sure about, the year I'm sure about. So results should contain peptic ulcer in which area. We want articles about peptic ulcer. Which area should it be there? Title, abstract, journal name, which area?
Year.
No, that is 2022. Peptic ulcer, in which part of your results should it appear? We want all our results to be about peptic ulcer. Which area is about? Which is the area where in the chat, then please read it out somebody. Because
Mesh.
I'm not able to. Mesh, excellent. Peptic ulcer should come in the list of mesh terms. And 2022, somebody already said year, that's right, date. So are both these compulsory? Obviously, yes. How will we do the typing? Which Boolean operator will be used?
And
And. Excellent. So the typing will be like this: peptic ulcer, mesh, and 2022 TP. Always search term followed by the tag, Boolean operator, second search term, tag, and so on. Right. My HOD told me to read up articles by Professor R.D. Brown in the journal Diabetes. How will we, I'm not asking bit by bit now, how will we frame the query? If anyone types, yeah. Go on.
R.D. Brown in author
Correct.
and in the journal Diabetes, that in journal JOUR
Excellent.
and
So
connected.
yeah, this is also very specific. Sorry, I forgot to ask that because both are very, very specific. Brown RD, you're in this PubMed, you need to type the initials after. That's the only thing. So Brown RD AU and diabetes JOUR. So just note your keyword, all this can be in any case. The tag can be in any case. Here I put in capital, here small, and has to be in capital. Third exercise, I want to find some clinical trials on oxytocin. Let's start little by little. About oxytocin, what is the tag I would use for oxytocin?
Mesh.
mesh.
Mesh. Excellent. Clinical trial. Okay, and before that, what kind of query is this?
It's a
I
type of
want to find some clinical trials on oxytocin. What kind of information need is this? Very specific, few articles to read, lots of articles, every article. Which type is it?
Again, very specific.
No, not really, because it says
articles.
I want to find some articles. So few articles to read.
Yeah.
If there are 100, I want maybe 5 or 10, like that. Okay? So some articles on this topic. Right. So oxytocin mesh, correct. Clinical trial, you remember the tag? That's the type of publication. What was the tag for it? Anyone remembers? It is PT. So how do we combine this? Oxytocin mesh
And clinical trials PT.
Excellent. So few articles to read, oxytocin mesh and clinical trial. In this case, of course, this is a small detail. For publication type, you only put singular. Those things, as you learn more, you'll be better at that. Clinical trial, PT. Right. I want to know how many publications have been authored by employees of Gandhi Hospital in the year 2025. What kind of query is this?
Very specific.
Very specific. One hospital in 1 year, right? Yes. So for employees of Gandhi Hospital, what do I search for that?
Author. AU.
Do we have the name of an author here? There could be several authors in Gandhi Hospital. What is Gandhi Hospital?
Title.
Everybody is not going to write this in Gandhi Hospital. PL is country of publication.
Someone said PL, place of publication.
Yeah, no, PL, place of publication is country of publication. So this will be AD, address of the authors. Employees will all be doctors, nurses, whoever. In the journal article, in that address area, they will write Gandhi Hospital, wherever, Mumbai, Ahmedabad, wherever it is. So Gandhi Hospital AD, then 2025?
DP, someone said.
DP. And Boolean operator?
And
And. Excellent. So this is very specific. Gandhi Hospital AD. The address is, every employee's address is Gandhi Hospital and 2025 DP. I want to find some articles to find similarities and differences between these two syndromes. I'll give you that both of them are in the MESH database, so you can tag it with MESH, that's one thing. But what kind of query? I want to read some articles.
few articles.
Few articles, excellent. How do we make this query now to find similarities and differences between these? CREST syndrome,
CREST syndrome, MESH term,
MESH,
or diffuse scleroderma, MESH term.
but I want similarities and differences between both. If I do or, I will get lots of them which are on CREST alone, diffuse alone. And you need and because I want to compare both. Right? CREST syndrome and diffuse scleroderma. I want to find out how many articles records are in PubMed about each of these. Now what will we do?
All articles.
Search. Yeah, first thing, the query is very specific because you want to find the number, whether it's 20 or 25 or 100 or 1000, whatever. Or, excellent, CREST syndrome or. So some in PubMed, there'll be say 100 on CREST syndrome, 1000 on diffuse scleroderma, both together. Some may be and, that will get removed. You'll get an exact figure. So we did those. And last thing, one important thing. Approximately 15 to 20% of citations in PubMed will not have MESH terms. That is, you click the title, go down, list of MESH terms won't be there. This happens because some journals, their articles do not get MESH. And the latest of even the best journals, it takes time for indexers to add the MESH. So if you want to find all the available citations on, say, CREST syndrome, you will have to search MESH, TIAB both. So CREST syndrome MESH or CREST syndrome TIA, like that. But that is for a particular kind of query. And let's take that example. I want to do a systematic review on paralysis in young adults. This thing is all possible articles. I should not miss any. Because I want to, when I do a systematic review, I'll be producing evidence of how much of paralysis there in young adults, etc. So I cannot miss any article. Okay. So if I'm searching PubMed, paralysis is a MESH term, young adults is a MESH term, but I can't search MESH alone. I have to search TIAB. I will get a lot of junk, but that's okay. I have to search that way. Let's see how this will work. As I said, paralysis MESH, paralysis TIAB, and all synonyms or similar words with TIAB. For example, paralytic, paralytics, paralyze, paralyze, all those options you've got to search. Plus, if there are synonyms like, I'll be showing you some. So how we will search for that paralysis would be paralysis MESH or PARALY star, that is paralysis, paralysis with E, that is the plural, or paralyze, paralyze with ZS, all that, or paralytic, paralytics, all those options will come. That's the use of the truncation. Or another synonym. So here it will be hemiplegia, hemiplegics, etc. And so on. We've got to think of a whole lot of such words to search for the concept of paralysis. Yeah, I've used quadriplegia, etc. Similarly, for young adults, we'll have to take teens, teenagers, or whatever, and that's adolescent, sorry. Young adults, we'll have to think of young women, young girls, all those synonyms as well. So for a systematic review, it's a very, very detailed search. That's advanced level searching. So with that, we are done on those things. I'll just like to sensitize you on the common errors and what you should be careful about. All of us have seen in the beginning, and or was a bit confusing. Towards the end, as we did exercises, we got better and better. So it's about practicing. Simple trick again, and remember together, or remember all or everything. You want everything, use or. You want the words together, use and. Using mesh tag for words that are not in the mesh database. It will still give you results, but what PubMed does is it will ignore the mesh and simply search for the word as it is anywhere. So you want to tag mesh, go to the mesh database, make sure your term is a mesh term, only then add the mesh tag. Using wrong tags. In the exercises, we saw a couple of examples like that. It's human to make those errors, but everything with practice, we get better and better. Trust me, you'll end up saving lots of time this week by knowing all the right ones. And missing synonyms, words, or spelling variations when you're doing systematic reviews. So you've got to see that you don't make these mistakes. So we've done all of it that we plan to do. This anatomy is as vital as learning anatomy to study medicine, dentistry, and things. Master this anatomy to learn more and to do efficient and correct searches. It's it's as important as your 2 times table and 3 times table or basic spellings, etc. So you will do better, easier research publications if this part. Of course, what we taught today, as I again insist, it's just the beginning. It's important to learn more than this. So the wise person is one who knows what he does not know. Most often in this, people didn't even know that there are things like this. I'm not saying about this audience. Overall, in our 19 years, we've seen this happen. And everyone must have an I must learn more. My colleagues and I keep learning more and more from international webinars or whatever we come across in articles, because there's always changes in technology, changes in PubMed happening. We keep, not just PubMed, many other sources. We keep ourselves abreast with all that. So what we want to do in future is mastering PubMed. We have an e-learning course on that. We do workshops on it, but we want to do this on the Echo platform, learning from them how to use this platform very well by teaching one thing at a time, asking you all to do exercises like this. Then by the next week, maybe, or after a few things, come back with cases. I wanted to do this topic, but I'm still having trouble, and how we can help with that. So that's a kind of, we've got to see how best. You can also give us suggestions. You're most welcome to do that. And we want to make this platform very vibrant for good learning. There are people who've learned off our e-learning platform, but what I've learned from many people is not everybody is mentally prepared to do just e-learning. They want this interactive events. So we are hoping this platform will offer them a very good opportunity. So what we believe we do is weekly sessions for the course on PubMed. We'll do each week a small thing so that you learn that thoroughly and go on. And we'll also give you this access, because then whatever you learned, we'll tell you in this section, these are the 3 videos you need to go through again before you come back, so that we are not going to provide recordings for those. You'll see those videos and come back for the next session. And as I said, practice with case-based exercises, which is Echo's real USP. And we want to maximize the use of that. So this we'll be announcing when shortly. All of you are on our list, so we'll definitely write to all of you. And if you're interested, you'll definitely join in. So we hope to see you all there. This is our e-learning platform. It looks like this. These are the different courses that are there. And we'll be blending this with the Echo. So I'm really looking forward to see all of you enroll and learn once we publish this. This is our email ID. You can write to us if you have any questions, any suggestions, etc. So thank you so much. And now we can take some discussion and questions.
Thank you, ma'am, for going through the entire life and being very patient uh, in going through the queries as well. I have given the unmute access to everyone. If there are any questions, any queries, you can either put it in the chat box or you can unmute yourself and we can take your questions.
Feel free to ask. No question is too simple. Thank you, Dr. Natasha. Any other comments, suggestions? You're welcome to do that as well, if you don't have a question.
Hello, ma'am.
Yes, Dr. Priyanka, please go ahead.
Yeah, thank you for such wonderful session. Though it is basically basic foundation is always important for everything, I believe.
Yes.
So this is good learning. My question is actually when we create such kind of basically the uh, terms and mesh terms and basically the strings. So uh, related to our research question, when we go with the PICO format or PO format, so we need to create a separate strings in terms of like using or
Yeah.
and so let's say with one word, the way we already did here, the basically the exercises with particular name, and then we did the particular comparison or maybe or and not with that. So if we have two, three terms, separate terms in one research question itself, so that time we need to add and to connect that different strings.
So I'll just explain that. For example, if you take that last question we did on paralysis and young adults, how we would do it is, I'll actually quickly just give me 1 second. I'll do a share. So in PubMed, if I go to advanced, what I do here is, first I would type here all the terms for paralysis mesh or PARALY star TIAB or hemi-PL for hemiplegia, paraplegia, etc. All those terms here, that I'll just put in two things and show.
Okay.
Now I may put lot more terms here, but just for ease of this thing, I'm putting only two terms. And I would do here add to history. So it comes here. Then if I put this young adults mesh or young whatever synonyms, all of them I'll combine with or. Any of them is fine. Add to history. So I have to now combine these two sets with and.
Okay.
This is an advanced level searching. So all databases allow you to do something like this. So serial number 1 and serial number 2.
Oh.
So this is, I've shown it very simply, but there are different ways. Sometimes it can be very complex searching.
Okay. And one more question is like, how we'll come to know, because we ourselves doing everything. So whether my string is right or wrong, even we narrow down by adding the filters. So is there any criteria the way you showed the mathematical
Yeah, so
calculation?
actually, there are two things in this. One is you've got to learn this very thoroughly about how to. So we have a course in our e-learning, advanced searching for authoring systematic review. So we actually have one video on how to find every available synonym for a thing, how to use the truncation, all those things. So that learning it is one thing, but in the West, they actually have a process of peer reviewing the search strategy. Usually one specialist asks another to peer review just as a formality, to make sure that, let's say I ask Dipti, then she will check and say that you seem to have missed some synonyms here. She's not going to give me all the answers. I found that you didn't use this, so check for more synonyms. So I know that there will be more. That kind of thing. Or I've used or instead of and, those kinds of mistakes. So if more people learn, you ask each other, that way it works.
Okay.
Yeah.
Okay.
I
Thank
saw
you.
a couple of other, no problem, most welcome. I just saw a couple of other questions. What other platforms other than PubMed? We could teach Cochrane Library. We could teach one free database called Lens. There's one called Drip Database, which is partially free. So we are open to doing all of these and that. Then, yeah, when to use mesh as per, it's not my guidelines, it's PubMed's guidelines or searching guidelines. So when to use mesh, simple answer is you want articles about something. Let's say paralysis, if I take, I'll go to the mesh database. Is paralysis a mesh term? Does the meaning tell me it's correct? I will use paralysis mesh. It's not a mesh term. I cannot use the tag mesh. I'll have to use TIAT. Again, in our PubMed course, we teach you, if it's not in the mesh database, how do you go and find what mesh terms, what other search terms could be used as mesh terms for this. So those are all in the more detail. Today's was very introductory. Thank you all for those questions. Anybody else? I hope everybody enjoyed it. And my request is that anytime we announce, please spread the word so that more people who show interest are most welcome to join them. So yes, Dr. Paridhi, I wrap up with that. You could do the needful.
So, ma'am, before we go towards the vote of thanks, I was just thinking if we can take a group photograph because it's an important step.
That would be lovely,
And
yes. Could
so
everyone come on camera for just a minute, please?
yes, if everyone can just switch on their cameras, we have beautiful faces and beautiful smiles. Okay, so on the count of three, in the smile. 1, 2, 3. Just take one more.
Yeah.
1,
Next
2,
page.
1, 2, 3. All right, thank you.
Thank you all very much. You're sharing the feedback or that will
Yes.
be later?
So before we move on to the vote of thanks, I'm just sharing the feedback link. The session will be on for another 5-10 minutes, so you can fill the feedback. It'll just take 30 seconds of your time. I would request everyone before you leave the session if you can share the feedback. And to formally close the session, I'll just be giving a vote of thanks from my side. Ma'am, would you all like to give vote of thanks? QMed team, if they would like to give.
So I think on behalf of the QMed team, I think I'm just so thrilled with how we've had good interactions with ECHO to plan this whole thing. And we really look forward to more because we want to learn to adopt the model very well. That's as brief and good as it is. So I'll give it back to you.
Thank you. Thank you,
Yeah,
ma'am.
she's just posted the feedback form, so please fill that in. It's
Yes.
very, very short.
So thank you so much, ma'am, for taking the session today. The webinar was very insightful, and I'm sure all of us learned something new. At least I kind of got reminded of my masters. So thank you for that. Thank you to Ms. Deepti and Ms. Fatima from the QMed team. Thank you for your support. And most importantly, thank you to the participants who took out the time to attend today's webinar. Thank you for your questions. We hope that today's webinar answered few of the questions, and we would love to see you again. Thank you, everyone. Before leaving, you can please fill in the feedback form. Thank you.
As she said, we are online for another 5 minutes. If anybody has questions or comments, you're most welcome to ask me.
So once you fill the feedback form, you can also kind of leave. You don't have to stay back unless you have any questions or queries.
How to get the slides or recording? Yes.
So for the slides, we'll be updating it on iEco platform. And I will be sharing detailed steps on how you can access the slides as well. Just allow us a day's time to kind of upload the slides and we'll guide you accordingly. You'll get an email regarding the steps. So just keep an eye out on your email and we'll update you soon.
Thank you, Janani Ravi. Yes, look forward to more feedback like that. So apart from doing the more specific blended learning sessions like PubMed, Zotero, and other things on request or otherwise, we plan to repeat this webinar at certain frequencies because there are many who registered today but obviously could not make it. Still, a good number has been present, which is nice. And there's always going to be a lot more audiences which need it. So definitely do spread the word as and when we tell you that we are announcing something. That would be nice. Maybe we can close the session then.
Oh, sure, ma'am. I'll do that. Thank you. Thank you, everyone.
So much. Thank you. Have a great evening.